I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana and one of the co-founders. You can just call me Dr. Rita. And if you have questions, I want you to put them in the chat and we will address all the questions at the very end. Tonight, we're going to talk about CBD and diabetes. Every single Wednesday, I pick a different topic. And I picked diabetes again this evening because diabetes is linked to so many symptoms, so many health challenges that affects really from our head to our toes. Literally, diabetes can affect from our head, the crowns of our head, our hair, all the way to our soles with neuropathy, the soles of our feet. So that's why I picked diabetes. We're going to do something a little different. I'm instituting this new sort of format tonight, and we're going to do something called a pre-test survey and then a post-test survey. That's going to give us an idea, really, if you are connecting, you're understanding what I'm saying, and you're getting what I want out of each topic that I want you to get out of. So tonight, again, is diabetes. We're going to start with our first question. So if you have a paper, your pen, or even your phone, you can put the answer in that you think is correct. First question, diabetes is defined as 1, my sugar is too low, or 2, my sugar is too high, or 3, my blood pressure is too high, or 4, my blood pressure is too low, or 5, none of the above. I'll give you a couple of seconds to record your answer. Next question, diabetes can be diagnosed by 1, a fasting blood sugar, or 2, a hemoglobin A1C, or 3, an oral glucose tolerance test, or 4, all of the above. Diabetes can be diagnosed. I'll give you a couple of seconds to answer that. Next question, signs that you may be diabetic. 1, frequent or excess of urination. Number 2, frequent or excess thirst. Number 3, darkening of skin. Number 4, unexplained weight loss. Or number 5, all of the above. I'll give you a couple of seconds to answer that question. Signs that you may be diabetic. Next question, the organ that is responsible in producing insulin. 1, your arm. 2, your leg. 3, the kidney. 4, the liver. Or 5, the pancreas. Which organ is responsible for producing insulin? Give you a couple of seconds to answer that. Next question, type 2 diabetes can be prevented. Answer number 1 is yes. Answer number 2 is no. And answer number 3 depends on my DNA. Type 2 diabetes can be prevented. Give you a couple of seconds to answer that. Last question, CBD can assist with symptoms of diabetes. Answer number 1 is yes. Answer number 2 is no. And answer number 3, probably not, since I've never heard of CBD. CBD can assist with symptoms of diabetes. Give you a couple of seconds. Wonderful. So let's move on to our topic. And you know, the first question that we want to answer is, do you know if you're diabetic or pre-diabetic? And that's really important. Every single person on this line should know if they're diabetic or pre-diabetic. Every single person on this line should know their hemoglobin A1C, okay? So if you know your hemoglobin A1C, put in the chat, yes, I know my hemoglobin A1C. We don't need to know what it is, but you can put in the chat, yes, I know my hemoglobin A1C. And if you don't know it, you can put in the chat, no, I don't know what my hemoglobin A1C, but I promise you, Dr. Rita, I'll find out from my physician. So diabetes is a condition in which the body doesn't properly process food for use as energy. Most of the food we eat is turned into glucose or sugar for our bodies to use as energy. So the organ called the pancreas that lies right underneath the stomach makes a hormone called insulin. Insulin helps glucose to get into the cells of our bodies. And when you have diabetes, your body doesn't either make enough insulin or can't use its own insulin as well as it should. And this causes sugar levels to build up in our blood. So that's why many people, especially our grandmas and grandpas, they refer to diabetes as I got that sugar, right? They say, I got that sugar. So there's different types of diabetes. There's type 1 diabetes where 10% of the population has. And this is the case that the body doesn't produce insulin at all. It's thought to be an autoimmune disorder where the body is attacking the cells in the pancreas and they cannot produce insulin. Type 2 diabetes, 90% of the population has type 2. So the body produces insulin, but it's not used efficiently, or it just doesn't produce enough insulin. And type 2 diabetes can be prevented. It can be prevented by having a healthy diet, being appropriate weight, having moderate physical exercise. These are some of the lifestyle modifications that I recommend that each and every one of you on this line that wants to prevent diabetes institute immediately. Healthy, balanced eating, holding an appropriate weight for your height, getting exercise, not being sedentary. These are some of the lifestyle modifications. And then in my field of medicine, there's something called gestational diabetes. Many of the women on the line may have had gestational diabetes during a pregnancy. And this is when we see high levels of blood sugar in pregnancy, and it usually goes away after you have your baby, but this is also a risk factor for developing type 2 diabetes later on in life if you don't do what you need to do with healthy, balanced eating, appropriate body weight, and physical exercise. So those are the 3 types of diabetes. So where is insulin produced? Well, insulin is produced in this organ. This organ here is called the pancreas. And the pancreas is found right underneath your stomach, adjacent to the small intestines. And it's the cells that we refer to a lot of times called those beta cells, the islets of Langerhans. These cells, or this portion of the pancreas, is where the insulin is produced. Insulin is then travel to the bloodstream to reduce blood sugars. We also have acinar cells. Those are cells that produce digestive enzymes, and these enzymes are traveled through the duct of the pancreas into the small intestines to help to digest proteins and fats and starches. So this is your pancreas. If you've never seen it before, this is where it's located. It's located right underneath the stomach, adjacent to the small intestine, and it is the organ that's responsible for producing insulin. This is the organ, when it doesn't function properly, it causes diabetes. So what does pre-diabetic mean? Well, pre-diabetic means that this is a stage before a person develops type 2 diabetes. It's a higher than normal blood sugar. It's not as high as someone who is diabetic, but doctors sometimes refer to pre-diabetes as impaired glucose tolerance or impaired fasting glucose, depending on the test they're using. But pre-diabetes predisposes you for developing type 2 diabetes and cardiovascular disease later on. So many people who have pre-diabetes don't have symptoms. You usually don't have symptoms. You're usually going for an annual exam and you get your hemoglobin A1C drawn and your doctor calls you back and says, you are pre-diabetic. And so you can diagnose pre-diabetes by a hemoglobin A1C that's between 5.7 and 6.4, by a fasting blood sugar that could be between 100 and 125, or a 2-hour oral glucose tolerance test that's below 200, around the 200 range, around 140 to 199. So those are the numbers that you should be looking for. So hemoglobin A1C, I really laugh at this little guy because hemoglobin A1C really can let us know as a diabetic if you're not being honest and transparent with your doctor, right? There's some people that manipulate their glucose monitors and they come to the office. Many of my patients know how to get into their monitor and make their sugar look normal. Well, we can do a blood test that will determine what's your blood sugar has looked like over the last 3 to 4 months. And it's called a hemoglobin A1C. It's a combination of glucose within the bloodstream along with our red blood cells, and together it's a glycosylated hemoglobin, I can't say the word tonight, which is called a hemoglobin A1C. So it lives in our bloodstream for about 4 months, so we can absolutely see what your sugar levels have been like if we think that that's an issue with those glucose monitors. So we can diagnose you with prediabetes and or diabetes by drawing a hemoglobin A1C. So a normal hemoglobin A1C should be less than 5.7. So for all of you out there that put in the chat that you know what your hemoglobin A1C, this will be very important for those who know their hemoglobin A1C. Now, prediabetes is a hemoglobin A1C between 5.7 and 6.4, and then diabetes can be diagnosed with the hemoglobin A1C of 6.5 or higher. We can also diagnose prediabetes and or diabetes with a fasting blood glucose. That means that your doctor brings you in, you haven't had anything to eat or drink for about 8 hours or more, and we draw your blood. So a normal person will have a fasting blood glucose of less than 100. Someone who is pre-diabetic has a fasting blood glucose between 100 and 125, and then someone who is diagnosed with diabetes will have a fasting blood glucose of 126 or higher. The last way you can diagnose prediabetes or diabetes is with an oral glucose tolerance test. This is a 2-hour test where we bring you in, we draw a fasting level, and then we give you some glucose to drink, and then 2 hours later we test your blood. Now normal will be a blood sugar of less than 140 2 hours after we give you this drink. Many of you are on the line that have had children. You remember that drink, right? It was really nasty. The doctors, we always tell you, oh, it tastes like Coca-Cola, or it tastes like an orange crust, whatever flavor you had when you were pregnant. No, it was very nasty. But normal will be a blood glucose level of less than 140 2 hours later. Pre-diabetics, 140 to 199. And then if you have diabetes, that level will be 200 or higher. So those are the different ways that we diagnose pre-diabetes and diabetes. So some of the statistics is really not good, right? There's over 100 million American adults, about a third of the population that are currently living with type 1 or type 2 diabetes. That's why this information is critical, because I'm sure you know someone that you can help, that you can assist with CBD that may be pre-diabetic or diabetic. Now, another 84.1 million of these 100 million are pre-diabetic, and they may develop type 2 diabetes if they don't take control of their condition, if they don't change things, if they don't start working out, if they don't start, following a diet, if they don't really change a lot of their poor habits. So it's a really serious problem, the prevalence of diabetes in the US. So one possible solution that's getting a lot of attention right now is CBD, CBD oil and other CBD infused products. CBD has also, and we'll learn, has been recognized as a solution to assist with a lot of other medical issues like seizures, inflammation, migraine headaches, and depression, just to name a few. So what are some of the risk factors for type 2 diabetes? High blood pressure is a risk factor, smoking, a diet that's high in fat, that bad fat, being overweight, sedentary lifestyle, having a large waist circumference. That's why when I see men that have these huge bellies and women who are postmenopausal that have this abdominal girth and increase in circumference in their waist, well, this puts you at risk for type 2 diabetes. It also puts you at risk for heart disease, because all of this fat that's on your internal organs is causing your heart to work harder. So research has shown that those who use cannabis and hemp products are linked to having a smaller waist circumference. It's linked to having a lower body mass index, and it's linked to having decreased levels of obesity. So CBD, we'll learn tonight, can help manage your weight, can help to suppress your appetite. CBD, we'll learn, reduces inflammation around those beta cells, around those islet cells of Langerhans in the pancreas. It improves energy burning capabilities, and it burns calories more efficiently. So it reduces your risk of type 2 diabetes. Long-term effects of diabetes. One is being nerve damage, neuropathy. I know you know some folks who have diabetes. They complain of pain, numbness, tingling in their hands and their feet. That's because that high sugar level over a long period of time causes a diabetic neuropathy. And so CBD has been found to reduce inflammation, to help to be an analgesic, a pain reliever, to protect the liver and prevent the development of neuropathy. In fact, we use gabapentin for neuropathy. If any of you are on the line and have used gabapentin or maybe on gabapentin, many times gabapentin is not very effective. So CBD can come in and absolutely be an alternative to help relieve pain and prevent additional neuropathy. Skin disorders. Many diabetics struggle with chronic skin sensitivity and irritation. They have sores on their feet. They have rashes on their body. Again, CBD's ability to reduce inflammation, being an anti-aging, being a moisturizing lotion can help benefit and provide relief from itching, burning, from skin irritations. Diabetics have a very slow healing process. So many times when they have an injury, a cut, or trauma to their skin, it takes a really long time to heal. So CBD products can help to accelerate that healing process. Lotions, creams, truly have been very, very instrumental in helping with that. So don't ignore the signs. You may be out there tonight and have signs that you never really thought about could be linked to diabetes, right? Frequent or excessive urination, frequent or excessive thirst, feeling tired throughout the day, feeling hungry more often, slow healing of wounds or cuts, difficult to heal infections, Darkening of skins. You see behind your neck, an area of your skin is dark. Blurred vision, unexplained weight loss. These are some of the signs that you don't want to ignore that could be signs of early diabetes. So let's move into CBD and how CBD can assist with some of these symptoms. You know, cannabis is a plant that has been used medicinally for centuries. And we do know that this plant has two species, one species being marijuana. That's the species that gives you the high, the euphoria, the paranoia. And then there's hemp. There's a species called hemp that gives you the health without the high. And the way it does that is that hemp contains a very trace amount of THC. THC is the compound that gives you the high in marijuana. But hemp also contains large amounts of CBD that has the health benefits. So when we talk about CBD or cannabidiol, it is the second most common compound found in different strains of the cannabis plant, but it's the most common one found in the hemp plant. It's unlike THC. It doesn't cause any mind-altering effects. It doesn't cause any euphoria. It doesn't cause any paranoia. It doesn't cause the munchies, but it has many, many medicinal benefits that we're going to go over. It also is something I've used in my practice for the last 4 years, and I've used it with other forms of treatment, like with insulin and metformin and other treatments that we give our diabetics to assist in the symptoms that diabetes can give our patients. So when we talk about these compounds, I must remind you that our body makes compounds just like the plant makes compounds. And they're called endogenous cannabinoids or endocannabinoids. And these endocannabinoids become deficient in our body when we are under a lot of stress, or we don't get enough sleep, or we're eating poorly. These endogenous cannabinoids that are really there to help keep our body in balance, to reduce inflammation, to improve blood sugars by reducing inflammation in the pancreas, when they get knocked out of balance, this is when we all need CBD, right? Because we're all under stress. We're all eating poorly most of the time, or maybe sometimes more than others. We're all having issues and difficulties getting our water in, you know? We can't avoid inhaling the air in the environment, but all of these external and internal factors cause our endogenous cannabinoids to be deficient, and that's why every single person that you know needs CBD. So when we talk about the cannabinoids that the plant makes, about 130 to date the cannabis plant produces, but CBD, as you can see here in the slide, is the hero, is the shero of the plant. Because CBD not only is an antibacterial, but it also inhibits cancer cell growth. It's also neuroprotective. So those neurodegenerative conditions that we face, like Alzheimer's, dementia, Parkinson's, multiple sclerosis, those who've had strokes and nerve damage, neuropathy, CBD can come in and repair those nerves. So it's neuroprotective. It also promotes bone growth. It reduces seizures and convulsions. CBD reduces blood sugar levels, and we'll talk about how it does that, but one way it does that is being an anti-inflammatory. It reduces the inflammation in the beta cells of the pancreas. CBD also reduces the risk of arterial blockage, and one long-term effect of diabetes is developing heart disease or coronary artery disease. It helps to relieve pain. It helps to relieve anxiety. There's a lot of anxiety around being diagnosed with diabetes and even having diabetes. It helps to be a vasorelaxant. So CBD can come in and dilate those vessels to improve blood flow. There's other cannabinoids like CBG and CBC and Delta 8 THC, which is a new kid on the block, that synergistically works on a cellular level to improve symptoms that we see in those who have diabetes. And the way it does this is science. See, CBD is not a magical potion. It's not a snake oil. It's not something that Dr. Rita just pulled out of her pocket, but there's science behind how CBD and the other cannabinoids work in our body, and it's through the human endocannabinoid system. And this is the body's primary regulatory system that modulates and regulates our sleep, our appetite, our pain, inflammation, memory, mood, reproduction, our blood sugar, our blood pressure, our pulse rate. And it does it by having receptors throughout our entire body. And you can see the slide here. There are receptors throughout our entire body. Every organ and gland, even the pancreas, has receptors that when you consume CBD, it puts the body back in balance by either reducing inflammation, being an antioxidant, and reducing free radicals in the body that destroy cells and organs, and improving our overall wellness. So that's the science behind how CBD works. So again, diabetics, it's really hard. Diabetics have to prick their finger, they have to test their blood sugar. It's anxiety provoking, especially if you're newly diagnosed diabetic. But we know that CBD can help to improve the insulin resistance. And insulin resistance is a key factor in prediabetes and type 2 diabetes. Now, type 1 diabetes is an autoimmune condition. That is when those cells completely cannot produce insulin. But we do know that CBD, through the research, through the data, can assist with the symptoms that type 1, type 2, and even pre-diabetics have. And those are symptoms of inflammation, of pain, of anxiety, of skin disorders, of hair loss. Yeah, diabetics can lose their hair. Why? Because that high sugar level and that inflammatory state that diabetics are in reduces blood flow to the hair follicle. So it causes hair loss. Alopecia areata is what it causes. This inflammation in diabetics can also lead to a reduced immune system, which can lead to cardiovascular disease, heart disease. So CBD is absolutely an option, a viable option for those who are looking for a holistic way to assist with symptoms of diabetes. And CBD is legal. The 2018 Farm Bill that was passed by President Trump legalized any product that is sourced or compound from hemp to be legal, to be sold, cultivated, and consumed in all 50 states. So the 2018 Farm Bill makes CBD legal. So we talked about diabetes and hair loss. This is a picture of someone who has alopecia areata. It is very common in type 2 diabetes. And again, it's because of that inflammatory process that's going on in the scalp. It's because of the reduced blood flow in the scalp to the hair follicles to allow for hair to be grown. So diabetics can present to their doctor or to their dermatologist with hair loss, not knowing that it is diabetes. Skin rashes, skin disorders, again, are very, very common in diabetics. Many diabetics have very thick, rough, darkened areas, and that's from an abnormally high level of sugar for a prolonged time. And that can be assisted with CBD as well. So let's move into our product line here at Wakana. A disclaimer that we cannot make claims that our CBD products will cure your diabetes, will treat your diabetes. But what we can say is that our CBD products can assist with symptoms that you may have because you have diabetes. You may have symptoms of hair loss. You may have symptoms of a skin rash. You may have symptoms of a joint pain or neuropathy, nerve pain. You may have symptoms of fatigue or insomnia or anxiety. So that's what we can say about our products, but we are not allowed to use words like treat, use words like diagnose with our CBD products. So let's move on to our tinctures. Our tinctures are CBD oils that you place underneath the tongue. Our tinctures are very unique in that all of our products are tested. All of our products have certificates of analysis where you can see that our products are safe and effective. They're free from mold, mildew, heavy metals, and pesticides that can just worsen your diabetes, right? Making sure that the legal limit of THC, which is 0.3% or less, are in our products. We have a power line, which is a full spectrum line, and we have a pure line, which is a broad spectrum line. Our broad spectrum line is great for those who want to use CBD but have random drug screens at their job. When you're using CBD products, you can also use them in a water-soluble form, meaning that you can put it in your water, your juice. Hopefully, if you're diabetic, you're not drinking that high sugary juice, but you can put it in your foods, as well as we have a product that you can bake and cook with. So our Culinary Plus product as well. These products are products that should be started low and slow. Whenever you're introducing CBD, we recommend you use our dosing recommendation on the bottle, which is 3 drops twice a day. Starting CBD low and slow prevents you from having any unwanted side effects, which could be nausea or headache or even excessive fatigue. So starting low with 3 drops underneath the tongue, holding it for 60 seconds before you swallow so the CBD can really get into the bloodstream is the way to use our products. Now, after 4 or 5 days, you want to see some improvement in your challenges. You can increase that to 8 drops twice a day. And the recommended maximum dose is 15 drops twice a day. We also have topicals. You know, we talk about topical products as offering local relief for those symptoms of neuropathy, nerve pain, tingling, a joint pain that many diabetics may have. I love our pain cream, our extreme relief. I love our Dr. Rita's rub as well. That is in an oil form. The Dr. Rita's rub is really nice because you can carry it around. It's in a little roller ball, and I just, apply it when needed throughout the day and evening. We also have our Power Body Mango Cream. We talked about how diabetics can have that thickened, dark skin irritation, rashes, itchy skin. Well, this topical CBD body cream would be great to assist with those symptoms as well. And then we have our edibles. We have products that we use and recommend for weight management, our flat belly coffee, that also will help that diabetic to maintain a healthy weight and lose weight. We have our bitters, which is a great detox. I think everybody, not just diabetics, need to detox once every month or once every 3 months. We also have an immune defense tea. Diabetics, their immune systems are compromised. So building that immune system, especially during this global pandemic. And then our gummies. We have our power gummies, which are our full spectrum gummies. We even have gummies for those diabetics who may have random drug screens at their job. So gummies help you sleep. They also are working to reduce inflammation, so you can use a gummy during the day. It helps with anxiety, it helps with insomnia, it helps with inflammation and pain. So you want to use those edibles as well. Now, for those diabetics out there that really are conscious about their sugar intake, our gummies have 2 milligrams of sugar. Very small amount, but I do want to disclose that for those out there that are looking for that information. And then smokables. Smokables are another great way to address symptoms that diabetics face, symptoms of that neuropathy pain that you want to address within 1 to 5 minutes. Smokables work really, really fast. They get into the bloodstream fast because they can bypass the stomach and the liver before they get into the bloodstream. So smokables are absolutely a great option for those diabetics who smoke cigarettes. You want to reduce their risk. You want to prevent those who are smoking who are not diabetic. You want to prevent their risk. I recommend the pre-roll. The pre-roll is a CBD joint that really helps to remove the cravings of nicotine. It helps to improve the withdrawal as you are coming off of nicotine. So those are our smokable products. And then for those diabetics who want to use CBD in the kitchen, right? We have amazing spices, our garlic fire, our flavor king, our chili lime. Again, you want to watch your sodium intake. So the information is on our bottles. 1 teaspoon is really all you need to flavor and season your food. We have a vegan butter that is also with our CBD line, a great product you can put in your oatmeal. Hopefully you're not eating a lot of bread or toast, but you can use in your oatmeal during the morning or any other meals that you are eating. A lot of people like putting our vegan butter in the flat belly coffee. It's an amazing way to reduce weight, watch your weight, and to bring down that inflammation. Now, our Culinary Plus product, this is a product I was speaking of that you can bake with, you can cook with. It's a great product for those who like to use CBD in a different way. These are just options for you because we have a lot here at Wakana. And then for those who are noticing hair loss, alopecia areata, they're noticing thinning because of their diabetes, or maybe they're noticing that and they didn't even know that they are pre-diabetic. Their hemoglobin A1C is right at that borderline. We have a whole hair care system called Save Your Strands. Our conditioner, shampoo, detangler, styling cream, even men, we have products for your beard and your scalp. We do know that hair loss is directly related to diabetes, high sugar level, high inflammation going on in the body, causing that hair follicle not to be able to grow. And then our essential oils. I want to highlight black seed. Black seed is absolutely essential oil that every single diabetic should have along with these other CBD products. Why? Because black seed has been shown in research to rebuild the beta cells of the pancreas, to help those beta cells, those cells in the islets of Langerhans, to help to produce insulin. So black seed, 6 drops in the morning, 6 drops in the evening. Yes, in addition to those CBD products, I recommend. How does CBD prevent diabetes? Well, we talk about prevention because you could be on the webinar and be like, Dr. Rita, I don't even have diabetes. Diabetes doesn't even run in my family. I'm healthy. Well, CBD can be used to prevent diabetes. So if you're not on our products, you want to get on our products. Why? Because a 5-year study showed that people that use cannabis or hemp products on a regular basis had a fasting insulin level 16% lower than non-cannabis users. This study also showed that people that use hemp products had a higher HDL. HDL is the good cholesterol. That's the one you want to be high, right? So this also can improve your cholesterol level, which is linked to a risk factor of being diabetes. So CBD, yes, can prevent diabetes along with exercise. I can't stress it enough. If you are sedentary, you want to get up and you want to get out. You don't have to go to a boot camp necessarily. You can just walk. You can just walk. It's getting nice outside in the Midwest. You can walk every single day. Just get active. Do something that you enjoy. Diet, I can't stress that enough. I'm here at the hospital. You know, I'm on call every Wednesday night, and I'm so excited to get off this webinar because I have yummy salmon. I don't know if you can see my salmon. I've got my veggies. Oh my goodness, I've got yummy, yummy, yummy plant-based diet. A diet that is free of processed food, fried food. You want to choose one day out of the week not to eat meat. I have given up meat. Yes, I don't know if you guys know that, but yesterday when I found out that my blood type doesn't like meat, I am only eating fish and plants. So you want to find out what your blood type is. You want to get off all that red meat. You want to introduce one day of a meatless diet and get your diet together. This will also help to prevent diabetes. So Dr. Rita's recommendation for those who have diabetes to assist with symptoms of their diabetes is one, our Power Hempranium 500 milligrams. I recommend you start this 3 drops in the morning, 3 drops in the evening. I also recommend you getting the black seed oil, starting with 6 drops in the morning, 6 drops in the evening. I also recommend you either getting our Dr. Rita's Rub, our Power Liquid Relief, and or our Extreme Pain Cream. And the reason why I say and or is because personally, I like using the cream at night. I put it on my sore, achy shoulder and knees and lower back. And I use the Dr. Rita's Rub. I carry it with me in my lab coat so I can just take it out whenever I need it during the day. I also recommend the Flat Belly Brew, right? This CBD coffee is going to help curb those carb cravings. The CBD coffee is going to help turn that white fat into brown fat. That's the fat that helps to increase your metabolism, to burn off calories, and to help to manage your appetite. That's that Flat Belly Brew. I also recommend our gummies. Again, our gummies do contain 2 milligrams of sugar. That's not a lot when you put it in the whole scheme of things, but our gummies, one a night to help you sleep, to help you get that restorative sleep, because sleep builds your immune system, right? Lack of sleep can kill you. I know. That's why I get those 7 to 9 hours. People are like, Dr. Rita, when do you sleep? I get my sleep. Just believe that. Our immune defense tea is something else I would recommend. Why? Because as a diabetic, as a pre-diabetic, and prevention of diabetes, you want to build your immune system up to be the strongest ever. Our immune defense tea, along with our bitter tea, I put the wrong thing there, not the flat belly gummies. You can use those too. But we have a bitter tea, a detox tea, that's going to help detoxify that liver, get those toxins out, build your immune system. I recommend that one time every 3 months, a detox immune one every 3 months. If you are really eating really bad for the next 3 months, you may want to do it once a month, but change that diet, get active, get on these products and change your life. So let's answer these questions now that you have this information. Diabetes is defined as my sugar is too low, my sugar is too high, my blood pressure is too high, my blood pressure is too low, or none of the above. The correct answer is it's defined as having a high sugar level. So number 2. Next question, diabetes can be diagnosed by a fasting blood sugar, a hemoglobin A1C, oral glucose tolerance test, or all of the above. The correct answer is all of the above. We can diagnose diabetes and prediabetes by a fasting blood sugar, by a hemoglobin A1C, and by an oral glucose tolerance test. Next question, signs that you may be diabetic or pre-diabetic. 1, frequent or excessive urination. 2, frequent or excessive thirst. 3, darkening of skin. Or 4, unexplained weight loss. Or 5, all of the above. And it's 5, all of the above. So be very, very conscious about things that are going on in your body, right? Be aware of what's going on. Take notice of changes so that you can get in and be tested. The organ that produces insulin: 1, the arm; 2, the leg; 3, the kidney; 4, the liver; or 5, the pancreas. Right answer is 5. The pancreas and the islet of Langerhans cells, those beta cells, produce insulin and distribute that directly into the bloodstream. So the answer is 5. Next question: type 2 diabetes can be prevented. Number 1, yes. Number 2, no. And number 3, depends on my DNA. And the answer is 1, yes. Type 2 diabetes can be prevented by your diet, by your exercise, by using products like CBD products. Your DNA can be changed. Your DNA can be changed. And your DNA can be changed by developing alternative lifestyles that maybe your parents had, or maybe your grandparents had. Maybe they were smokers. Maybe they were overweight. Maybe they loved eating fried food all the time or fast food all the time. That can be changed. That can be prevented with you. Next question: CBD can assist with symptoms of diabetes. Number 1, yes. Number 2, no. Or number 3, probably not, since I've never heard of CBD. Well, we know the answer is number 1, yes. CBD can assist with symptoms of diabetes, symptoms of nerve damage, neuropathy, symptoms of hair thinning, hair loss, symptoms of fatigue and tiredness, the symptoms that lead to being overweight or abnormal, unhealthy weights. Yes, all of these symptoms: insomnia, depression, anxiety, all of these symptoms CBD can assist with. So I want to thank you for joining. I'm going to take some questions now. If you have questions, you can put it right there in the chat. And I see we have Dr. Betty on the line as well. She's part of our Wakana Medical Advisory Board. And we've got lots and lots and lots of people on the line. And let's,
Right.
Dr. Betty, if we have,
Hi.
how are you? So
I'm
good
awesome.
to see
I'm
you.
awesome. So I just wanted to pop in and just throw a little bit of a few nuggets in. What an excellent presentation you did. Thanks, Dr. Rita. I just wanted to bring up the issue of the mental emotional aspects as it relates to diabetes. There's a book called You Can Heal Your Body by Louise Hay. And in this book, she goes through many different symptoms and diseases, and gives the metaphysical or mental emotional equivalent of these particular diseases. And for diabetes or hyperglycemia, the issue is longing for what might have been, a great need to control, deep sorrow, no sweetness left in life. And so she also offers affirmations to help to detach, disengage some of these belief systems and attitudes. And for diabetes, the affirmation is, this moment is filled with joy. I now choose to experience the sweetness of today. And so
I love that.
isn't that
I love
beautiful?
that.
Yes. And so this also helps with the stress, the increased stress that we might be feeling from the sorrow, the grief, anxiety, and other emotional upsets. And Dr. Rita mentioned the importance of exercise, because that actually helps to decrease stress, because stress increases your blood sugar level and it increases your cortisol level. And all of that increase in the blood sugar level and cortisol, it fuels the inflammation, which increases the risk and occurrence of complications of diabetes, like peripheral neuropathy. There's been some studies done as it relates to black seed oil, and how it actually increases the level of serum insulin, which improves insulin sensitivity of the muscle cells and the body's glucose tolerance, thereby easing the severity of diabetic neuropathy. So black seed oil and even adding some fenugreek seeds help to decrease this neuropathy. Plus, it keeps your blood sugar in check. So I just wanted to bring those out, and some other exercises. Meditation is great. Yoga, qigong, and just walking. Just get up and move, and that will help to lower your blood sugar level. Peace.
I tell you, I have the most amazing medical advisory board in the world. Thank you so much, Dr. Betty, for dropping nuggets every single Tuesday and Wednesday. Can you repeat the name of the book?
Yes, it is You Can Heal Your Body by Louise Hay. You can get it on Amazon. You can get it on Kindle. Great to have. Great to have.
I'm going to get that book. I'm absolutely. Thank you so much.
Thank you.
I know we have Erica Zachary on as well. She's part of our medical advisory board. She is a licensed clinical social worker and counselor, and just an amazing testimony of our CBD products as it relates to multiple sclerosis. Erica Zachary, did you want to chime in, and then we'll take these questions that are on the chat?
I did. Thank you, Dr. Rita. And it's actually not about MS today. So thank you, Dr. Betty, for sharing the information you just shared. So you know, guys know I'm a teletherapist. So I have probably, right now I'm drowning in clients. I have probably about 50 clients. And I can tell you at least half of them are diabetic. And so in one of the platforms that I work in, I work with a company, a contract with them. And my clients, I work with actually dietitians. And so what ends up happening is when the dietitians start to see them and they realize, wait a minute, you know, that they're not doing well, and their mental health is a barrier to them doing well working well with the dietitian, they will send them to me or other therapists in the platform.
Wonderful.
And so thank you for sharing that book, because guess what I'm going to do? I'm going to look it up tonight so that I can share it. Yeah, because it's major, because, you know, a lot of them do feel like, Dr. Rita, and thank you for your presentation, that, oh, my mama had it, my grandmama had it, it's nothing I can do about it. And so it's always fighting to let them know that you can make changes. Like, you control, you know, my favorite saying is control what you can control. And that's one of the things that they can control. It's just letting them know and helping them walk through it. And so I really appreciate this presentation today, because it's very useful for me in another way. So thank you
so much. Thank you so much, both of you. Stay on the line. We're going to answer some questions. First, for Dr. Betty, you mentioned something after black seed oil. Black seed oil plus, unmute yourself.
Fenugreek seeds.
Say it one more time.
Fenugreek. It's spelled FENUGREEK seeds.
Did you get that, Jewel? Fenugreek seeds. You can put that in the chat.
I'll put it in the chat. I sure will. And Louise Hay's last name is spelled Hay. I saw somebody had HAT.
Yes. Mm-hmm. Yes. So they're asking that you type that in the chat, Dr. Betty.
I sure will.
And yes, if Charlene is still on the line, yes, this is recorded and we post it on our Facebook page, this recording. Antonia says, I am type 2 diabetic. I get extremely stressed when my blood sugar levels get too high. I can't wait to start my CBD. And I cannot wait for you to start your CBD as well. Be consistent. You know, I can't stress that enough. So many people will come back and say it didn't work. Mm-hmm. And you question them. Well, how long did you take it? And were you consistently taking it? So you've got to be consistent with the products. You've got to be consistent with your exercise, and you've got to be consistent with your diet. All of these things together will give you the results that you're looking for. I'm a testimony. I had a heel spur. Oh my goodness. Consistent with my products. This right shoulder basically is gone. The pain. I don't know what I did with it, but I was consistent with my topical. I was consistent with my tincture. So be consistent. Any other questions? Let's see. Someone says, my 12-year-old is pre-diabetic, so this is why I wanted to ask about the seasonings as well. What did you ask about the seasonings? Let's see.
Dr. Rita, while you're looking that up, let me add to that because, you know, it's still amazing to me. One of the things I love about this company is that we do offer so many different products.
Yes.
Right. And so I was looking to manage my MS. I was looking for products, and I only knew about CBD oil. I did not know about not one single solitary other product. And so it was nice to see so many different things that are available. And I am definitely a product of the product. I use them all. So I just wanted to add to that.
Absolutely. And I love doing that as well, Erica, using them all. Layering is what we call making sure that that CBD is consistently in the bloodstream. And you can do that in so many ways via topical, edibles, tinctures, spices, butters, coffees, all sorts of an amazing product. So, okay, so are the culinary products only to be used for adults on meals? So our culinary products are power products. They do contain 0.3% or less of THC, so it's to the discretion of the parent. So if you are the parent, that's your discretion to use either the spices and or the butter and or the gummies. We do have gummies and tinctures that are broad spectrum products that contain less than 0.0% or less of THC. I do know it's been the discretion of many parents to give their child our broad spectrum products because they're not really comfortable with giving them a full spectrum product with the small amount of THC. So hopefully that answers your question for the 12-year-old. It's to your discretion as a parent as to what you want to use. But we are not marketing to children. We're not marketing to anyone under the age of 21.
But Dr. Rita, let's not forget the benefits of black seed oil
Yeah.
for that 12-year-old.
Thank you. Speak,
Yeah.
Dr. Betty, speak.
So yes, please utilize black seed oil because just as Dr. Rita said, it does stimulate the beta cells of the pancreas, to produce insulin. So it's great that he or she still produces some insulin. So that speaks to their not being type 1 diabetic. And so all the things that you can do to help to keep that insulin flowing, being produced and flowing is definitely to their benefit. And don't forget about those mental, emotional aspects of it. Most people have no idea how much our thoughts, our emotions affect our physical health. In fact, we can make ourselves sick with
Absolutely
our thoughts.
We can.
So please get that book and start to help him or her to learn how to meditate, to do positive affirmations, and to empower them because that'll make a world of difference.
So true. Thank you, Dr. Betty. Thank you for that as well. So that is all for us this evening. It's 8:59. It's time to go upstairs and deliver some babies, some COVID babies, as I call them. We will see you here next Wednesday. feel free to email me and give me some suggestions of topics that you want to hear about. My email is ritamd@wakana.com. We're excited to celebrate our 2-year anniversary. So we've got our Wealth Explosion Conference coming up this weekend. So if you're a guest on the line, please connect with the person that invited you so you can get your products ordered, you can get your tickets ordered, and be in attendance with us for our huge, huge celebration this weekend. So good night. Thank you, Dr. Betty. Thank you, Erica, Zachary. I appreciate and love all of our business partners, all of our guests. Be well, be safe, and we'll see you this weekend.
And Dr. Rita, there is one more question in there about the hair, about the hair products. If they could get back to the person that invited them, then they could certainly get some insight into those hair products.
Right. And that truck driver that cannot use products with THC, absolutely recommend our pure broad spectrum product, our pure products they can use. They can use all of our topical products because they won't pass the blood-brain barrier. They can use our black seed. They can use our essential oils. So we have a lot of options for even truck drivers and others who have random drug screens. So
Must be
thank you.
another question about fertility issues, but I guess they can get back to the person that invited them.
Where do you see all these questions?
I saw that one in the Q&A.
Oh, sorry.
Okay.
What are the benefits on fertility issues? I have a potential customer that's asking about CBD benefits. Yeah, so CBD, as we know, the endocannabinoid system has receptors in our reproductive tract. So our ovaries, our uterus, our testicles, in reducing inflammation, 1, improving blood flow, 2, and putting hormones back in balance, 3. So that's how CBD improves fertility. So yes, you want to connect with that customer, let them know that information. And that sounds like a good topic, CBD and reproduction, fertility.
Great. Yes.
Well, have a good night. Thank you again. We'll see you this weekend. Be well and be safe.
Night.
Good night.
Good night.